Arun Thukkani, MD, PhD. I'm an interventional cardiologist at Central Maine Medical Center. I perform coronary interventions, coronary diagnostic procedures looking at the heart arteries, also structural heart interventions, and I have a interest in cardiogenic shock patients. So we're entering a new phase of cardiovascular care with new technologies. And what that meant in the past is that patients were actually put in a box and either treated by the surgeon or treated by the cardiologist or the interventional cardiologist. And now those things, the boundaries between those disciplines are disappearing. And so what I like to do, what we like to do here at Central Maine Medical Center is a multidisciplinary approach to cardiac care, and especially structural heart disease and coronary artery disease. That also goes along with our care in shock. We bring in a number of different specialists when we take care of these critically ill patients. I've always wanted to be someone who treats the heart. My dad was a cardiac surgeon. I didn't think that that was really what I wanted to do. What I love about what I do is, again, the multidisciplinary approach and the fact that we're able to really affect change with innovative platforms. So catheters and valves, or valves that are mounted on catheters that can be introduced into the body without a large incision, new technologies that are always actually being introduced and developed. So that's really what's exciting to me and why I do what I do. So again, this sort of, my interest is in structural heart disease and then cardiogenic shock, and there have been a lot of innovations in both of these arenas that have allowed us to treat patients better and provide better outcomes. I was born in Milwaukee, Wisconsin. I actually grew up in Portland, Oregon. I was there till I graduated high school, and then I went to college on the East Coast, and then I was in St. Louis for a long time. Did some of my training in Boston. Ended up here in Maine because one of the doctors here recruited me here, and you know, I couldn't pick a better place to be, raise a family. I mean, it's beautiful here. I think the people are very, very nice, and I think this community is special, and I think we can make a big impact at Central Maine Medical Center in the health and well-being of the community around us, and I think in the region. We have the opportunity here to reinvent kind of the care that's being given here in this area. So we collected a lot of, I think, really talented people, especially in the CMHVI division from cardiac surgery and interventional cardiology. It's really special what we have here. And I think we're going to be able to make an impact here in the region in trying to bring these cutting-edge therapies to, I think, an underserved population.